always find it here on OB-GYN Chats, where we talk about those very uncomfortable topics, but it's very necessary. And like we say, it's your free consultation with Dr. Simon. Thank you for joining us again.
Hi, Alka. How are you?
We can't complain. When we educate the nation, at least we have changed one mind to be a better, more healthier
I think that's the most important thing.
That is.
At least we contribute to the knowledge that the people have and about their health, and that's the most important thing.
And thank you for OB-GYN and the team as well.
No, thanks to you.
Yeah, definitely.
Yeah.
You can
always having us.
Yes, no, we should. We should. So it's not just a two-way conversation, but it's a three-way conversation. You can feel free to add your comments and your questions right on the feed below as well. And we will ask Doctor to have a follow-up as well. So this edition is about fibroids. If you heard about it and don't know what it means, Doc, what are fibroids?
You know, uterine fibroid is one of those most common condition in all women. And I'm sure every woman have heard that word, fibroids.
Yes.
You know, I have fibroids.
I've heard it
I have
before.
myomas. So fibroids are non-cancerous tumors, usually that grow in the woman's womb. They are commonly, we found them in a woman of the reproductive age. So any woman from the age of 15 to the age of 50, they can have uterine fibroids. And the most important thing here, the term that we should elaborate to our listeners and our viewers, is that it's a non-cancerous tumor. So it's a tumor that grows in the uterus, and it's not a cancer. And because sometimes when a woman here have fibroid, they start worried, oh, what's going to happen now? Am I going for chemo? Am I going for surgery? So it's become a worrisome situation, and one get worried, but it's not a cancer.
Okay.
Yes.
Should a lady be proactive by doing checkups, doing those scans, or would you advise someone just to live as normal as possible until symptoms pop up?
Yeah, so fibroids are very common. According to the literature, it's about, you find it in 1 in 3 women that would be having fibroid. Obviously, if we pick it up, and they can have it without any symptoms. So in most cases, we only diagnose fibroid when a woman comes with symptoms. And then one of the most common symptoms is either they have pain, they have heavy bleeding, or they've been trying to conceive. Or you pick them up when just a woman comes for a routine checkup without any symptoms. So one can have fibroids, but not everyone will present with symptoms. Some of them won't have any symptoms at all. And if there's no symptom, like the one I reiterated earlier, the pain, bleeding, or pressure symptoms, or fertility issue, then we just leave it alone. If it's an incidental finding, there's no need to operate unless the patient now themselves feel like, I think something should be done about this.
Okay. So, Doctor, you briefly, rushed through 3 on top of your mind as well.
Yeah.
So maybe let's try to go into more detail.
Yeah.
If I do have signs of that, what would the most alarming ones be? Or what are also those underlying symptoms that we overlook as women?
Okay, so with uterine fibroids, the most common symptom that we get is bleeding. But so the symptoms of a fibroid depend on the location. So the uterus being the organ of a woman where the periods come from. So we have the endometrium cavity, where usually which break down every month. So if a fibroid is in that cavity, in the endometrium cavity, that one will always bleed. It doesn't matter the size. But the moment it's in the cavity, the woman will present with heavy bleeding. So that's why the symptoms of a fibroid depend on the location and the size. So one can have a fibroid which is about 10 centimeters, which is very big. But because it's located out of the uterus, it's just on the wall of the uterus, they might not have any symptom. And one can have a small fibroid as small as 0.5 centimeters or 5 millimeters, but because it's in the cavity, they will come with heavy bleeding. So one of the most common symptoms that one should look at is abnormal menstruation bleeding, which might be very heavy, or it can be irregular periods. And the other thing will be pain, just chronic lower abdominal pain. They'll have pain. And the other thing that they might have is pressure symptoms, that you start peeing a lot. You wake up at night, you have to wake up about 3 times because you have this big fibroid which is occupying the pelvis. And again, now the bladder, when the bladder fill up, so the size of the bladder has become reduced because of the pressure from the fibroid, and then they start peeing a lot. And in some women, they will present with constipation. And also some, they will just present because they've been trying to conceive and they're unable to conceive. Then it's because obviously the cavity is occupied by those non-cancerous tumors.
So most of the times for a lady, doctors would prescribe either a surgical route to treat it or a non-surgical. So maybe let's focus on when the doctor, gynecologist says, look, you need to go into surgery.
Yeah.
When do you make the diagnosis or that decision? And when is it safe for you just to take medicines? And if you can, does it go away if you treat it?
Yeah. So when it comes to treatment of fibroids, it should be individualized based on the patients. Like exactly like you said, depend on the symptoms of the patient and what also the patient desire. So if it was an incidental finding and this patient doesn't have any of those symptoms that I mentioned or doesn't desire fertility at the moment and they don't have any symptoms, and we leave that fibroid alone because it doesn't cause them any problem. Then eventually, because the fibroid, like I said, it is a disease of a woman of the reproductive age. It's a reproductive age because it feeds on hormones that usually, when a woman goes through their menstrual cycle, they produce hormone, then fibroid feed on that and they grow because of that. So eventually, after menopause, because there are no periods, there are no menstrual cycle, the fibroids stop feeding. Then eventually they shrink and disappear on their own. So if it doesn't have any symptoms, we just do what we call expected management, and we keep following up to make sure there's no new symptom developing, and eventually wait until menopause and it will shrink on its own. That's what we call expected management.
Okay.
So we have now what we call medical management. Though someone come with a fibroids, there are some symptoms, and we can offer the medical management. The most medical management that we use is just to treat the symptoms that they have. Sometimes because of pain, you can give them an non-steroid anti-inflammatory drug like Brufen, and because it can assist with pain. And if there's bleeding, we give them some medication that will make the bleeding stop, based on usually to make the blood become a bit thicker and stop bleeding. And that's most of the medical management that we can give, but we can also use the famous IUCD, Mirena. I'm sure most women have heard of a device Mirena, because the loop we only hear of a loop. There are two types of loop. There's a copper and the Mirena. The Mirena is the one that have hormones. So usually Mirena can be used for women who have bleeding, but obviously based after clinical assessment, who have fibroids and they're bleeding, it can reduce the menstrual flow. So it can also be used as a non-surgical, non-invasive way of treating fibroids.
But I'm going to stop you there, Doc, because now if you mention Mirena, when you get loop, you're not expecting kids. So how does now this change the whole ball game if people still want to conceive and they've got fibroids?
That's a good question, because it goes back, like all the treatment must be it must tailor based on the patient desire. Someone who desires fertility, they want to fall pregnant, they have fibroids, we can't offer them a Mirena. Because a Mirena, as much as it is for contraception, it will help to treat the bleeding, but if they desire fertility, that option is already out, because they came with symptoms. But someone who came because of bleeding and they don't want to have a baby, then we can use that, obviously, to reduce the bleeding. So the other way, if someone has symptoms, that's when now we involve other mode who want fertility or they are bleeding actively and they desire to conceive in the future. Then we bring in other method of treatment where we have your non-surgical, or like uterine arterial embolization, or like your high ultrasound frequency that we use to bend the fibroids, or then we go to surgical, which means we're going to be surgical removal of fibroid, which can be done as an open surgery where we cut open the abdomen, or we do it laparoscopically, which is minimally invasive, where we go in with a telescope and we remove the fibroid. But obviously that depends on the size and the location of the fibroid. So the mode of the surgery or the mode of the treatment is more based on the patient, what the patient desire, if they desire fertility or not, and more based on the symptoms that they have and the expertise available. Because there are also some of this method I mentioned, they might not be offered at wherever the patient is.
Are fibroids reoccurring if you do the surgery? If you get rid of it, can a woman, get fibroids again after a year or two?
So that's a very common question, and unfortunately the answer is yes. In most cases, when someone had fibroid, especially if we have in an early age, the likelihood of them coming back is high. So, and this goes back to the way we treat that. If we do surgery, these are micro. You get those small tumors that are there, and eventually, even if you go for surgery, there will be some that you won't feel with your hands or you won't see with your naked, and you leave them there. Then eventually, with time, as they still get their hormones, they start growing again. So the recurrence of fibroid, in most cases, is they always come back. And we advise that if a patient will go for surgery, especially if the main indication is for fertility, we advise them, if there are no life-threatening symptoms, rather go for surgery when you are planning to conceive. You know already that I'm going for surgery, then I'm planning to conceive like in a year or two. But if you are doing it for fertility reason and you are not sure if you would like to conceive in the next 5 years or so, then you rather withhold the surgery until when you are sure, unless there is an indication which is maybe based on the symptoms, pain, bleeding, or any other symptom.
Great. There's so many questions, and as we are wrapping up,
Yeah.
Doctor, at OB-GYN, you are
Yeah.
the top in modern technology,
Yeah.
getting educated further about, these non-invasive
Yes.
procedures, etc. I'm going to read the next one because there's a lot of, technological guided questions here.
Yeah.
But they talk about the ultrasound guided procedures
Yeah.
and embolization, depending on the size and the location. Maybe let's just wrap up with the
Oh,
terminologies just to
yes.
zoom in a little bit more.
In most cases, when our patients hear you have fibroids, the first thing that comes to mind is surgery. That, it means I'm going to go another knife. It's either you worry about I'm going to theater. So the management of fibroids, there are non-surgical way of treating fibroids. But again, in medicine, and unfortunately, 2 + 2 is not 4. Medicine 2 + 2 can be 100. Eh? So we can't. We don't do it routinely where we just say the treatment is tailor-made based on the patient's symptoms. So which means also based on the size of the fibroid that the patient have, the location of the fibroids. So there are methods like uterine artery embolization. Uterine artery embolization, and also the one that you were mentioning, which is HIFU. It's a high intensity frequency ultrasound, which used to be banned. So when you go to HIFU, I'm just going to speak a little about it because we don't have it available in the Namibian market. In the South African market, they have it, but it's more in the state. It's more at the Chris Hani Baragwana Hospital, and I think they have one in the Western Cape. But it's the new technology which they are using the ultrasound frequency to burn the fibroid. Usually they shrink, but also have its own limitation. I'm not going to go too much deep in there because we don't have it lately, and it's also not offered neither in the state or private. But I'm going to focus more on the uterine artery embolization. So uterine artery embolization, what it is, it means we have the uterus, then there are uterine arteries. The uterine arteries are the arteries that supply blood to the uterus. So uterine artery embolization means, in conjunction with the intervention radiologist, you are going to ablate and to put something to block the blood supply to the uterus. Once you block the blood supply to the uterus, eventually these fibroids, there's a limit of blood that goes to them, and eventually they shrink. But it also has its own limitation because it depends on the size. If the fibroid is very big, sometimes it doesn't work. But the other controversy is that in women that desire to conceive, because it's a very good non-invasive method to treat fibroids. But the only issue that the women who desire to fall pregnant again, there is a bit of controversy because if you block the vessel that feed the uterus, as much as the uterus feeds from other collateral supply, these are the main blood supply to the uterus. So in the future, when you fall pregnant, there's a limitation of the blood that is pumped to your uterus. Then this can affect the way the baby, first in the first trimester, you can end up with a miscarriage. It can affect the way the baby will grow. The baby can have what we call intrauterine growth restriction. And it's also have it can put you at risk of preeclampsia. So, but these are studies that are going on. But because of the uncertainty and unavailable data regarding the safety of uterine artery embolization in pregnancy, for women that want to conceive, we try to go the surgical road rather than the uterine artery embolization because of those unknown risks that are there. Ideally, for someone that decides to conceive, for someone who have already completed their family and they have fibroid and they don't want to fall pregnant, definitely that's a good option because it's non-invasive, it's safe, it's a day procedure, and it's done, and the recurrence rate is not so bad.
Yeah.
But for women that still desire to fall pregnant and they have a large size fibroid, the ideal way will be either to go for surgical management, which can be now, depend on the size and the location of fibroids, can either be laparoscopically or open surgery. But in most cases, like for us at OB-GYN practice, all our most, I can say 90% of our myomectomies, or which means removing the fibroid, we do them with minimal invasive laparoscopic surgery or either hysteroscopically, which is via the vaginal.
And it's a good success rate.
And it's a good success rate. Yes, yeah. So again, even if it's treated, we know that the recurrence of fibroid will always be there, but we try to put in our good expertise and try to do them very well so that patient is secure, that patient will be able to conceive later and have a successful pregnancy.
At the end of the day, for the baby
definitely.
and for the mom.
Yes.
Dr. Simon, you guys are doing a fantastic job. Thank you so much. Keep it up. And to more of the educational sessions, thank you.
Thanks a lot, Ilka, for having me today. I mean, fibroid is a complex topic, and
we can go on
we
and
can
on
go
and on.
and on.
Definitely.
And I'm sure there'll be more questions to be asked.
There will be. And
Yes.
again, we invite you to put your comments at the bottom of the feed. And Doctor is still here for free consultation. Thank you very much. We'll be back with the next episode.
Thank you.